PQA Innovation Theaters are opportunities for PQA member organizations to showcase their innovations, technology services, and research in this unique forum. This is your opportunity as an audience to learn more about and ask about these innovative solutions in the marketplace. We are thrilled to continue the 2020 Innovation Theater series with Omnicell and Enhanced Medication Services. Our two speakers today are Mark Gregory and Anna Hall. Mark Gregory is the Director of Pharmacy, Pharmacy Consultant of Population Health Services with Omnicell. Mark has a very diverse and awesome career. I'm not going to read his giant bio because I want him to be able to tell his story and what he's working on now. But Mark, thank you for all of your work with Omnicell, and you've been with them since July of 2014. Joining Mark is Anna Hall. She's the Director of Quality Services at Enhanced Medication Services. Like Mark, she has a very diverse and awesome background. And again, I'm not going to steal her thunder, and I'm going to let her tell you about herself and where we are in healthcare quality. So Mark, I believe you're starting our presentation and helping us understand how Omnicell and Enhanced Medication Services are improving medication use quality.
Yeah, thanks, Jake. That's awesome. And Jake from Alabama, this is Mark from Raleigh, North Carolina, and appreciate PQA for this opportunity, and done a couple of these virtual conferences, and very unique, right? So also congratulations to the CPIC award winners, and especially, some of the retailers that are being recognized, because, after a long career on the front lines of retail pharmacy, it's really great, gives me great pride, right, to say all the patient care activities that's happening on the front lines today, and that's should give everybody some pats on the back for getting through what we're going through today. So joining today, Anna Hall, right, and Anna and I are excited to share information about a joint Omnicell and Enhanced Medication Services model that includes over 20,000 pharmacies nationwide, and allows us to deliver a value-based pharmacy intervention model to improve adherence and decrease costs for patients with chronic conditions. So that's where we're headed, right? So Omnicell, right, is an industry partner with solutions fueled by data and analytics to assign the right patient to the right intervention. Our engagement solutions range from smart patient communications, medication synchronization, chronic care management tools, and MTM software driving CMRs and TMRs. The solutions work independently, or as we will discuss, can be combined in an effort to manage patients based on need. The patient engagement platform is the engine utilized in pharmacy workflow, parallel with the dispensing technology, to manage patients to successful outcomes. Today, we will discuss a program still in its infancy, but utilizing multiple touch points with patients in various cohorts assigned by cost and risk. And Anna's going to expand on that.
Thanks, Mark. Thanks, everyone, for joining on this Thursday. My company, Enhanced Medication Services, connects health plans, PBMs, and other clinical program sponsors to our vast network of community pharmacies through our pharmacy management system software. And in that software, we have in-pharmacy workflow alerts of clinical intervention opportunities for those pharmacists. So when a pharmacist is filling a medication, they'll see an alert that there's something they plan to talk to that patient about, or wants that pharmacist to talk to that patient about, and they can interact with them right there when the patient is filling their medications. This is all backed by our leading clinical services call centers that are based out of Orlando, Florida, that's where I'm at today, and St. Louis, Missouri. We manage the contracts, our operational coordination with our clients and plan sponsors, and that helps us to deliver coordinated interventions through live pharmacy interaction and telepharmacy delivery models to achieve results. That's the EMS model. Our clients partner with us with Enhanced Medication Services and Omnicell because they need to resolve gaps in therapy. They need to optimize medication use for patients. and their member populations. And the goal is, of course, always to ensure safety and effectiveness, to improve adherence, and to meet plan performance goals, and ideally to reduce avoidable healthcare costs, which we'll talk about in our intervention highlight today. We all know that most patients interact with their pharmacies more than any other healthcare professional, more times during a year than any other healthcare professional. So we've created a model that allows for very simple coordination of value-based relationships between clinical program sponsors, such as health plans or PBMs, and pharmacies. At all the conferences I go to, I'm always hearing presentation after presentation about value-based arrangements and intervention coordination with prescribers or other providers. And today we're going to talk about a model in the pharmacy space that does just that with pharmacies. Today we want to focus on one of our current intervention models that's proving to be very successful. It's in a Medicare population, and the disease states, as you can see here, that we focused on are diabetes, dyslipidemia, heart failure, hypertension, and atrial fibrillation. Patients are stratified into two risk groups, the high-risk group and the low-risk group, and those patients are stratified based on total cost of care, all-cause readmissions, 30-day readmissions, and emergency department visits, and then some secondary criteria of medications and diagnoses. The interventions for our high-risk group, they receive the chance to enroll in a medication synchronization program, a comprehensive medication review, and then we check in with them monthly. A pharmacist checks in with them to follow up on those interventions and see how they're doing with their medications. And also to remind them to go and pick up their medications at the pharmacy on their scheduled synchronized date. Interventions for the low-risk group include only enrollment in the medication synchronization program. And our payment model that we mentioned, for each cohort, the payment for the intervention model includes a simple base fee. It really just covers our cost of doing the stratification, setting the groups up, and attempting to engage those members and getting those interventions out in front of the pharmacies. So we're really just covering costs there, but of our reimbursement is a value model where there is a success fee that is only paid for each member if specific program goals are achieved. Over the years, I have to say that nearly all of our services are based on value-based payment. Clients really depend on that because they are really depending on the success of our programs.
So back to me, foundational, as Anna mentioned, to all the different cohorts in the study is an appointment-based medication synchronization model, right? Which includes that monthly check-in with patients by the pharmacy. And as Anna mentioned, the high-risk group also receives a comprehensive medication review and condition-related check-ins. So historically, MedSync for the top therapeutic condition categories, inclusive of the triple-weighted measures, consistently we see a 20 to 31% PDC differential for those medications enrolled in a MedSync program versus those not enrolled in a MedSync program. Also, a side note, right, what we are witnessing today in today's COVID environment is how critical it is to improve medication adherence, minimize the trips to the pharmacy, establish a frequent check-in with a healthcare professional, the pharmacist, but also have some positive downstream benefits of minimizing avoidable hospitalizations and ER visits. So the study noted here, the Harvard study published in Health Affairs, whereby our pharmacies were utilizing the Omnicell MedSync program, right, with 23,000 patients with cardiovascular disease. It had a positive impact on adherence rates and a 9% decrease of hospitalizations and emergency room visits. Next, Anna. So we're tracking the similar types of things in our current project, right? And for our current project in this plan year, Tracking and projections for PDC scores is showing a gap between our members that are enrolled versus those not enrolled. In all of our multiple cohorts with various interventions, plus medication synchronization, both low risk and high risk PDC trending is showing 11% gap of PDC at year end. When we isolate the 3 triple weighted categories, the same trending is evident. Tracking events, medical cost and events also, right? It's early on, and we've been pleased with the preliminary results for medical cost savings. But of course, there's nothing normal about 2020 and medical spending. But through February of 2020, from the inception of this project, we saw a decline in medical costs for patients that enrolled in the interventions. But we'll definitely need a longer runway to watch these cost and event trends over time.
Thanks, Mark, and thanks everyone for letting us share about the really important project that we're currently working on. We're very excited about and how it's trending, as Mark shared. Omnicell and Enhanced Medication Services have a wonderful partnership. Our services complement each other and programs complement each other. And we've been able to achieve significant results together in projects like the one we talked about today that really drive population health for our clients. We partner and provide a full spectrum of medication adherence and medication therapy management interventions that touch the lives of patients and also caregivers and some of our caregivers. We thank you for joining us today. We've provided our contact information here on the next slide. If you'd like to learn more about our programs or any more about the project that we talked about today. And I think we're gonna open it up for questions now.
Yes, we will. And Anna, Mark, thank you so much for your presentation and sharing some of your insights and some of the great work that you're doing. I really like how you talked about how this can really benefit individuals in our quite crazy times when we think about social distancing and not getting out of our houses. So one of the questions that's come in is, you talk about value-based networks and this network of pharmacies. So how do you decide whether a pharmacy is in network or out of network?
You want to talk about the Omnicell network, Mark?
Sure, yeah. I mean, we have a, like I said, over 20,000 pharmacies in our network, right, that are all, right, have built this model and at least basically the MedSync appointment-based model into their daily practice, right? So everybody's that is utilizing the Omnicell technology is in the value-based network and, you know, has signed up to be a high performer in that network.
Yeah, and a portion of the Omnicell network is direct users of Enhanced Medication Services parent company transaction data system, or direct users of our pharmacy management software. So that's where we get also further integrated alerts into the pharmacy management system for the pharmacies that use that as well.
Awesome, perfect. And so you talked about how there's integration within that pharmacy management system. So is that how the pharmacy itself is able to kind of keep track of when to synchronize or what dates to fill with their medications?
Yeah, that's right. I mean, what the platform, right, is integrated in a number of ways, right? In that pharmacy dispensing information from that platform is critical to drive interventions and engagements. So we get regular data from those pharmacy management systems. We utilize a system where we automatically post prescriptions in the MedSync program into the dispensing platform. So it fits right into the workflow of the pharmacy. And then, as Anna had mentioned, there's multiple touch points with the patient, right, throughout the month, and reminders of their appointment date that is approaching.
Awesome, perfect. So one of the newer things that we see within community pharmacy practice is the real advent of the e-care plan, or having a little bit more kind of non-dispensing information available to the pharmacist. Does this help with care coordination? Are there any type of care coordination plans when you look at this service, and how do you partner with health plans or other sponsors?
Yeah, for transaction data systems, we integrate directly, as we mentioned, into our pharmacy software so the pharmacist can see all of the interventions available to be completed on patients. And we will soon also have, I think it's okay to say it, we will soon also have an e-care plan where pharmacists can also keep track of pharmacists provided services where they may be caring for patients. I know that's been really important, and we've provided our pharmacies with things like COVID assessments so that they can track the patient care that they're providing, especially with the new opportunities opening up for pharmacists as providers, and that, you know, COVID really opened the door for us this year. They can track those right there in the same system, you know, where they're filling prescriptions for patients so that everything's very organized and easy to get to, as Mark mentioned, when a patient is there in the pharmacy. And same for the Omnicell patient care engagement tools that the pharmacies use.
So thank you. Second to last question. Do you have any type of patient satisfaction? Like, have you been able to engage patients? What have they said? What's the word on the street?
Yeah, actually, in the current project, you know, we do outbound check-ins with the patient and capture information in surveys, right, about patient satisfaction. And there's an overwhelming greater than 90% response rate of finding the information valuable, right, on a month-to-month basis, right? And then also, as far as satisfaction, you know, we certainly see patients that are enrolled in a MedSync program. It's very rare that they unenroll from a MedSync program. So that itself, as far as the attrition from folks unenrolling, you know, would speak to itself that it's a highly valued service.
I always go back to all of our front and technicians. All of our pharmacists and technicians, our frontline staff that is engaging with the patients or in the pharmacy or on the phone, they all, you know, no one ever minds working on medication synchronization because it's very engaging to the patients. You know, it's a very easy offer, and, you know, hardly anyone minds getting their prescriptions all at the same time each month. So it's always really pleasant thing to talk to someone about.
Awesome, thank you. So last question before we have to transition to our next presentation. How do you sign up?
There's our phone number. Give us a call.
Yeah, please do that. I mean, here's Anna's information and my information. Just reach out and we can provide you some more information or sign you up.
Yeah. Sounds like a great plan. Anna, Mark, thank you so much for joining us.